Hey, I hope that by now you have heard about Ozempic, Wegovy, or Semaglutide. And these are all three the exact same substance. Semaglutide is the generic name. Ozempic is the form that's indicated for the treatment of diabetes. And Wegovy is the form that's indicated by the FDA for the treatment of obesity. And of course, as a practicing physician, it's my judgment and discretion on which one we use and how we use it. And it might be your insurance company's discretion on which one they pay for, they cover. Today, I want to cover several myths or misconceptions or exaggerations related to these medications. I've been prescribing Ozempic for over 5 years now. I have extensive experience with this medication in my diabetic population, and for the past 2 years have been prescribing Wegovy and Semaglutide primarily for weight loss. So I've used it in a wide variety of clinical settings and have experienced most of the actual problems that can occur in my patients. I've been on numerous telelecture with endocrinologists and other experienced providers, so I'm very well versed in how this medication works. I've been seeing a lot of online and social media advertising that's trying to debunk or minimize the potential effectiveness of these medications. And I'd like you to know that these are people that are just simply trying to sell you something else. It's really not their place to discourage you from something that is an excellent, cutting edge, could not have come at a more important time medication. One of the criticisms is, well, you just have to keep taking it or else you're going to gain the weight right back. And I would say to that person, so whatever process you have, we have to do permanently or else we'll gain the weight right back. And I would just say, well, duh. I mean, you got to do something effective continuously in order to get that effect. It doesn't matter whether you're an Olympic swimmer or if you're a stay-at-home mom doing the valuable and crucial work of raising children. Whatever you do, you have to do it consistently and effectively in order to get that result. They're expensive. Well, it's a new medication and it's covered and protected by patents. Everything when it's first under patent is more expensive, and that's normal, and that's important to help protect future research and development. One of the criticisms is people will use this inappropriately. Hello, have you met your friends and fellow humans lately? I can't think of a single thing that everybody uses appropriately. And I can't imagine why that would be a great reason to not use something. I would simply say, use it appropriately. And if you come to my clinic to get it from me or our nurse practitioners, we are going to coach you and supervise the process to be sure that you're not just using it properly, but that you're getting the effective benefits that you need out of this process. Lifestyle alone is sufficient. This is not true because we can think of countless examples of where simply changing your lifestyle did not result in the looked for effect. Some of this has to do with genetics. Some of the things about me genetically may make one lifestyle change not as effective as adding a medication. But the most important thing to consider here is that when we talk about lifestyle, we're talking about the way in which you live your life. And without the proper understanding and education and access to resources, you can change your lifestyle all you want, but you're not going to get an effective benefit. So using semaglutide is an excellent and very healthy way for you to be able to achieve an important health goal and use it as you need to in the future. So I hope that if you're riding the fence and you're not really sure if you want to use semaglutide or not, I hope that you will, number one, stop listening to people who are just being discouraged. That's not going to be helpful for anyone. Number two, if you need some additional help, you can get an appointment with us for a nutritional consultation or pay attention because pretty soon I'm going to be offering online nutrition coaching and I can give you some help there as well.